and welcome to Core on the Floor. So today we are going to be using a small ball. If you don't have a ball, no worries, you can use a pillow. So if you need to stop and pause this and grab a pillow or a ball, that is fine. There are no modifications for this video, so if getting on the floor is not for you, you can back out of this video and you can try one of the other core videos. So we're going to start lying on our backs. So if you have the osteoporosis diagnosis, let's shift to the side and then roll onto your back. So what we're going to do, we're going to start out by squeezing the ball between our knees. So the ball is between our knees, our feet are bent. We're going to give that a gentle squeeze in and then lift our bottoms off the ground. Now obviously if you have forward rolled shoulders and you have some forward posture and this is uncomfortable, I want you to take a pillow underneath of your head and neck to support your spine, support that neck. What I don't want you to do is have a bunch of tension in your head and neck and then end up with having a lot of neck pain. So we're just gently squeezing that ball and we're lifting our bottoms up and down. We have about 30 seconds left. The squeeze that you're giving on the ball should be about 20 to 30%. So you're not like massively squeezing the ball. It's just enough to gauge those inner thighs. All right, we have about 5 seconds. Squeeze that butt. Great job. We're going right into the next one. So squeeze the knees together. Pull the tummy in nice and tight. Lift the knees with the squeeze and slowly lower. What I don't want to see here is a lot of low back arch. So if your low back starts to arch, I want you to tuck in that tummy. You can always remove the ball and do single leg march if needed. So for right now, I'm squeezing the ball, tummy's tight. I'm lifting and lowering. As your core gets tired, you will find that this is a little harder to do with not allowing your back to arch. So if that's the case, I just want you to modify and do the single leg march. Great job. Take the ball and move it towards your ankles. So legs are straight. I'm going to slide my thumbs under my bum and just give a gentle squeeze between my ankles with the ball. And we're just going to drop a few inches and squeeze it back up to center. A few inches, squeeze it back up to center. You do not have to drop all the way down here. We're just going a few down with straight legs and back up. Slow lower. It is not easy to hold this ball between your ankles. If you don't have a ball and you're using a pillow, I really urge you next time you're out at Walmart or one of the big box stores, find just a small rubber ball. You can get them for really cheap, and this really magnifies this exercise. Great job. Drop that ball. And bring your knees down. Give yourself just a little bit of a rest here. Then we're going to lift both of our knees in the air. We're going to hold the ball against our knees. So tummy is nice and tight. If you cannot do this while keeping your low back on the mat, I want you to bring one foot down and bring one knee up. So what we're going to do is you're going to alternate pushing the knee into the ball and release. Alternate knee into the ball and release. Let me show you how that looks like with one foot. Push in, lower the knee, push in, lower the knee. I'm just moving the ball from left to right. I'm resisting the pressure. And if this is too easy for you, and you'd like to advance, both knees up and arms are straight. You're pushing one knee at a time into the ball. Again, with a 20 to 30% rate, you don't have to go crazy here. We're not really pushing up with 100% force. And you should really feel that core engaging. Mine is on fire. You may get a little shaking, perfectly fine, and perfectly normal. All right, great job. Give yourself a little bit of a rest. We're going to move on to our side. So rolling onto our side, we're going to squeeze the ball between our ankles. So I'm going to come down here and rest on my arm. You can come all the way down, and maybe you're just now trying to get situated here. This ball, oops, I lost it. So knees are bent, and we're going to lift that top knee. So lift. I'm going to move it down just a little bit further here. Lift and lower. So it's just like the clams, except we have a ball underneath of our ankles. This makes it much more difficult to keep that ball in place. As you can see, normally I use a ball that has a little air out of it, and you can do that too. Just take a little bit of air out of the ball so it stays in place a little better. We're almost there, a couple more seconds. Drop the knee together and open. You should feel this in the side of your hip and a little bit in your glutes here, because remember, glutes are a big part of our core. What I don't want to see is a lot of upper body motion. So close the knees, open the knees, and keep that pressure in the ankles. Great job. Just slide that ball up and squeeze it between your knees. And what we're going to do here, you're going to roll back just a little bit onto the fatty part of your glutes. So just roll back so you're not directly on that bone, that hip bone. If you're having discomfort here, just throw a pillow underneath of your hip. And what we're going to do is we're just going to raise your feet off the ground just a few inches and lower. Raise and lower. We're squeezing that ball between our knees and we're lifting, or the pillow, whichever you have. You should have no hip pain here, so if you are, you need to roll back just a little more, which activates your core, or you need to throw a pillow underneath of your hip. We're going to do just a few more. 2 and 3. Great job. Go ahead and bring yourself to a seated position, and we're going to roll over onto the other side. So we're going to move that ball in between your ankles. Again, if this is a ball that you're going to be using for the exercise only, you can take a little bit of air out of the ball to make it a little easier to squeeze. Mine is a little more difficult because it's full of air. So we're going to squeeze those ankles together. Knees are bent. We're resting on our on our hand, and we're gonna open the knees and down. Open and down. If this is super frustrating and you can't seem to keep your ball, it's perfectly fine. You can go back to the old-fashioned clams where your ankles are just squeezed together and you're just opening and closing. This just adds a little more dynamic because when you're squeezing the ball, we're activating that pelvic floor and all those inner thigh muscles and a lot of other stabilizing muscles, making the core work a little more advanced and just changing it up a little. You're doing great. All right, move that ball to between your knees. The knees are still bent. We're rolling back onto our glutes just a little, just so you're not on that hip joint. Remember, slide that pillow underneath if you need, and lift the feet just a few inches. Notice how my upper body stays nice and calm, nice and stable. Gentle squeeze between the knees. Beautiful job. All right, pull that ball up. We're gonna do just 2 more exercises. So we're gonna be on all fours here. Ball is gonna go between our knees. So ball is between our knees. Tummy is tight. You're getting ready to be like in the bird dog position, except we're tucking our toes under. So you're in all 4 of the quadruped position. You're pushing away from the floor so your shoulder girdle is engaged. Toes are tucked under. What we're going to do is squeeze that ball. We're going to lift the ball off the floor just an inch or 2 and come back down to the floor. Lift just an inch or 2 and lower. Lift, lower, lift, lower. Give me 5 more of these. 1, 2, 3, 4, and 5. Great job. Put the ball out in front of you. We're going to finish with a plank. So we can do our plank on our knees or a plank in a full plank. I'm going to show you both. The ball is going to sit in front of us. What we're going to do is we're going to tap the ball. So you're coming into a full plank or knees on the mat. So you choose. Here's knees, here's full. Tap the ball, tap the ball, tap, tap. Now I have my feet nice and wide. Tailbone tucked, tap, 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 tap. One more time, tap, 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 and bring it down. Great job, everybody.